Hello listeners, welcome to Views on Health. A great pleasure to have with me on the program Dr. Nilangika Sandakumari, consultant physician and senior lecturer in pharmacology, University of Sri Jayawardhanapura. A warm welcome to our studios, doctor, and I should also say welcome back.
Yeah, it's a pleasure to join with you again to share knowledge on medical topics.
And the topic tonight under discussion is osteoporosis, a topic that we haven't focused on for quite some time. And according to Dr. Nilangika Sandakumari, more and more patients are presenting symptoms related to osteoporosis. Having said that, I hand the microphone to you, doctor, to enlighten us on this medical issue.
Yes. So, osteoporosis is a disease related to bones. When the bone structure is not optimal, when there's bone demineralization, when there's a problem with calcification of bones, and when the architecture of the bones is not normal, this condition occurs. This is osteoporosis. Bones are weak, so they are prone to get damage, and the fracture risk is very high in patients with osteoporosis. So we are worried about this disease because of this high risk of fragility fractures. Even a mild trauma can result in fractures. So I think most of you all have seen patients with osteoporosis. When they fall, they damage their hip bone. And fracture neck of the femur is a very common condition, especially among elderly population. And fractured wrist is another common presentation. All these are most likely due to osteoporosis. Weak bones due to defects in bone mineralization and destruction of bone microarchitecture, resulting in high risk of fragility fractures. So this condition, as you correctly said, is very common now. In the developed world as well as developing world, both, especially the elderly population, is affected by osteoporosis. Why is it common, so common? So if you look at the risk factors for osteoporosis, common risk factors are lack of exercise, alcohol and smoking, and also early menopause, especially in females. If their menopausal age is earlier than 45 years, then their female hormones are not there for the bone growth and calcification, so they are prone to get osteoporosis. So other than that, immobility, either due to an accident or surgery or any other condition causing the patient to be bedbound, is a cause for osteoporosis. And the other thing is nutritional factors. If you don't take adequate vitamin D and other nutrients needed for bone growth, then it makes you more susceptible to develop this condition. And certain diseases like kidney diseases, other hormonal problems may also contribute to this increasing trend of osteoporosis. So it's a condition that will give rise to increase the mortality as well as the morbidity in advancing aged population. But still, I feel that we don't pay much attention on this topic. We don't talk more about osteoporosis. We don't talk to the same extent that we talk about diabetes and hypertension. We don't talk about this condition. So most of the people are unaware about the condition as well as the risk factors. They don't know what causes this. Only that they think that taking a high amount of calcium will cure this, but that is a myth. So we'll discuss about management later. So the condition is increasing, and these are the contributory factors.
Thank you, doctor. Now, as in Sri Lanka, we have an aging population that is increasing.
Yes.
And set to increase further in the years to come.
Yeah.
So you're very likely to see more patients with this condition once it sets in.
Yeah.
Not everybody has osteoporosis, but once it sets in, I mean, in the sense in terms of where automatically there's the aging process,
Yeah.
and the wasting of muscles and bones, all that. I mean, we know, we are educated enough to that extent,
Yes.
though we are lay people, to know that these things happen. But like I said, to the best of my knowledge, not every person is going to have osteoporosis, but those who have it,
Yeah.
who are susceptible for various reasons and they get it, then of course they have to take extra precaution and
Yeah.
be careful. And you also, what you said, Dr. Mati, is very familiar from our end, is to see more of the elderly people with hip bone fractures.
Yes.
So the wrist, of course, even if you're young and you're doing some sports, likely that you can hurt your wrist, and of course you recover in whatever way you're treated according to the injury. But the hip fracture is very, very, I think, in line with this age group, the old age generation, and they have this issue. So can you tell us where this sets in? How, at which point does this set in, or how did this set in? You spoke of saying calcium alone is not going to help. It is a myth.
Yeah.
Then how does it come about?
Yeah. So when you take the growth of a bone, there's bone formation by a type of cells called osteoblasts. Osteo means bone, blast means they are the ones who generate bone tissue. So osteoblasts will generate bone cells. And in the meantime, we have another type of cells called osteoclasts. Clast means they eat up the bone. So you have osteoblasts, which will form the bones, and osteoclasts which will eat up the bone. And our bone density depends on the balance of the action of these two types of cells. There must be a balance of osteoblasts forming the bone and osteoclasts eating the bone. So what happens is, most of the time, osteoblasts do their work at a given constant rate. But in patients who are prone to develop osteoporosis, osteoclasts eat up more bone than in other people. So the bone becomes weaker. There's a negative balance. So in hip fracture also, what happens is, the bone, the femoral bone, that is the main bone in your thigh, that one becomes weaker when the bone cells, osteoclasts, eat up the bone material. So that can weaken the bone, and the sites that are more prone to get damaged is the neck of the femur. That is the part where the head of the bone attaches to the shaft. The weakest part, narrowest part of the bone, the neck of that femur, can easily break up. So how can we identify whether you are having osteoporosis in this bone is by doing a particular test, specific test called DEXA scan. So DEXA scan will identify your bones, whether the mineral density is okay or whether it is less than normal, whether your osteoclasts have eaten up more bone. So this DEXA scan, you do it on your hips and also in the vertebral column. Now, similar to the hip fractures, vertebral column fractures is also common among elderly. So that also will end up in a disaster, because if you break a bone in your vertebral column, sometimes it may damage the spinal column which goes inside the vertebral column. So you may not be able to walk, your legs may not work properly. So vertebral fractures are also equally harmful. So most of the time, people with osteoporosis present with ongoing back pains, and they will notice that their height is reducing. And this back pain may be due to either a small fracture of the vertebral column or it may be due to weak bones. And when you do this DEXA scan, you can identify whether you're having osteoporosis or not. So DEXA scan will give you a score. Now patients, after getting the report, come to us with the report telling that they can't interpret the report because it is given as a T score or Z score. So what is this T score? It will compare the density of your bones with the standard accepted density of bones. So it is given as a negative value. If it is less than 2.5, minus 2.5 the standard value, then you are labeled as a osteoporotic patient. So that is the state where you will need to be started on treatment specific for osteoporosis. So this DEXA scanning is the accepted method of investigation. But you can do plain X-rays. Plain X-rays will not show up the bone density. It will just show up the weak bones, bones with less mineral deposits, but you can't quantify and say whether you're having osteoporosis or not. So plain X-ray will not add much into the diagnosis. You have to go for DEXA scanning. It is available in government hospitals even. And in the bloods, now I told at the beginning that most of the people do think calcium deficiency is seen with osteoporosis, but usually with osteoporosis calcium levels are normal. If you do the blood test to see what is the calcium level and what is the phosphate level, calcium, phosphate and parathormone levels are normal usually. What is deficient in osteoporotic patients is vitamin D. So vitamin D levels, if you do it and your results are less than 20, then the deficiency is vitamin D. So vitamin D replacement is a must in osteoporotic patients. So along with vitamin D, when the bone formation starts, bone will need more and more calcium. So along with vitamin D, we co-prescribe calcium. But calcium deficiency is not seen in osteoporosis usually. It's vitamin D deficiency, and DEXA scan we can do and diagnose the condition, and you have specific treatment options we will discuss later on. So usually we prescribe vitamin D and calcium for the deficient vitamin D, and when the vitamin D acts, bone will reform. So as an assistant we will co-prescribe calcium also.
Thank you, doctor. So that clearly explains the need for which vitamin that will address this problem.
Yes.
Rather at least help towards alleviating the damage that it can further cause to the bones, as against just going by what one thinks is calcium is the best for bones, and because that's what we grew up with. Drink a lot of milk, it has calcium, good for the bones, good for the teeth.
Yeah, but milk will contain vitamin D.
Yeah,
also.
That's right.
Yeah.
But I'm saying basically now that is something that we have learned.
Yes.
But people generally say drink milk, it's full of calcium.
Full of calcium.
They don't say it's full of vitamin D, or it has vitamin D. That is not highlighted. So basically we having going by that sort of belief that it has the calcium content, and therefore it is a must. This is children must have milk in their formative years, all of that. So having said that, doctor, now at which point would this actually set in? Assuming that the proper nutrition has not been followed. There are sort of just eat what you want to eat, or you eat what you can eat, but you don't get your balanced diet, all of that. So osteoporosis won't suddenly come up. It's building in the system.
Yes. Yeah. So as you said, if you don't take diet adequate in vitamin D supplements, then it can, now in our country that is not a big problem because we can get vitamin D even from sunlight. But in other countries, especially in winter months, they don't get enough vitamin D. But still, elderly people who are housebound and don't go out much, I have seen a lot of patients with severe vitamin D deficiency. So that is still a problem here. And this, as you correctly said, this is a process which happens over a long period of time, not just in one day or two. So specifically prone people are the ones, elderly females, because their female hormones are now declining. After the menopause, their female hormones are declining, and as they grow older and older, female hormones which are needed for bone growth is no more there. So gradually the bones get distracted and the bone deposition occurs, but bone osteoclast action also increases, and then gradually the bones will decay. So it sets in after the menopause usually. After the menopause, gradually over next few years, the bones will become weaker and weaker with time. So when this is picked up, we ask patients to do some lifestyle interventions as well as to take some medications. So what are the lifestyle interventions you can do? Now, if you know that you are having osteoporosis, you have to minimize the risk of getting a fracture. So you must not walk at night without any lighting, and you must not step into the slippery areas. If you fall, you may end up in getting a fractured wrist or a hip, sometimes a fractured vertebra. So avoid stepping into slippery areas. Try to minimize falls. If you walk upstairs, always get hold of the railings, and like that you have to minimize the risk of falling and getting a fracture. And in the meantime, you have some medications also. Now, along with medications, it's important to be physically active. Exercise will reduce this bone decay. So sometimes some people don't like to walk even, because they think if I fall then I will injure myself, and they like to stay in. But then you are not using your bones, you are not using muscles, so the osteoporosis will get aggravated. You need to walk. Jogging is a very good exercise. So jogging, walking, and even climbing upstairs very carefully can strengthen your bones. So you have to be physically active. And then alcohol and smoking, you have to stop this. It was like shown that alcohol and smoking will contribute to osteoporosis. So stopping that is also important. So other than that, you have a lot of medications. If I'm to just before talking about medications, I want to tell insist one point here. Certain medications can cause osteoporosis as well. Now, steroids like prednisolone, dexamethasone are very commonly used as well as abused nowadays. So they are used to treat certain types of diseases called autoimmune diseases like rheumatoid arthritis and other arthritis type of diseases. So if you are prescribed with long-term steroids like prednisolone, it increases the susceptibility to develop osteoporosis. It will weaken the bones. So then in such situations, you have to prescribe drugs which will protect your bones. So we have drugs named bisphosphonates. Already I think some people listening to this program may be on these drugs, bisphosphonates. They are the mainstay of treatment for osteoporosis. So what bisphosphonates will do is, now at the beginning I told osteoclasts are the ones that we don't want here. They are the bad cells. They eat up our bone. So these bisphosphonates will go and inhibit these osteoclasts. They will prevent osteoclasts from eating up the bone. So you have bisphosphonates which can be given by mouth or by injection. So if you are going to take steroids for a long time for arthritis or whatever condition, you need to take one of the bisphosphonates along with those steroids also. So you can take them by mouth or you can take them by injection. Injection is given once a year. So if a patient is having osteoporosis and doctor decides to give bisphosphonates by injection, the patient needs to get admitted to the ward for the injection, and every year it has to be repeated yearly for 5 years. If you take the drug by mouth, bisphosphonate by mouth, it is given as a weekly drug, 1 tablet once a week, and again you need to continue it for 5 years. Now the name of the drug is, the most commonly used bisphosphonate is alendronate. So if a patient is prescribed alendronate, we will give them specific instructions how to use it. This drug should be taken by mouth on an empty stomach. When you wake up in the morning, before eating anything else, you have to take it. It's only once a week, so one day you have to take this. Even before eating your breakfast, you have to take this, and then you need to stay upright position, in the upright position for half an hour after taking this. You can't lie down, and you have to drink a lot of plenty of fluids. Why? All this is because the drug is known to cause severe irritation of esophagus. Right? So to prevent that damage to the esophagus, the drug should be taken on an empty stomach in the upright position and remain up in the upright position for half an hour with plenty of water. Right? So the drug is very well known to cause severe esophagitis otherwise. So you have to do that every week, weekly for 5 years, and if it bothers you, you can ask your doctor, can I take this by injection? If you can take it by injection, then it is only once a year, but giving this injection needs hospital admission, and it is given under supervision, right? So, so taking this drug for 5 years, 5 years. Now the drugs have something called half-life. That is the time period that the drug stays in our body. The half-life of these drugs are very long. So when you take the drug, the half-life is 10 years. It will stay in the bone for long time. So you don't have to continue with medications for other drugs like diabetes. If you take it for 5 years, it will remain inside your body for 10 years. So then you are protected for a certain significant period of time. So such drugs are there.
Thank you, doctor. Now, obviously this drug is supposed to alleviate the problem.
Yes.
Maybe not totally cure, but alleviate.
Alleviate, yeah.
So now when you talk of the sitting in an upright position for half an hour after taking the drug,
Yeah.
in other words, you don't have your tea or coffee on an empty stomach.
Yes.
But can you drink water? You can.
Yeah, you have
Yes.
to take plenty of water with the drug.
You can even first drink water and then take the drug and then drink
But
water.
it is advised to take it on an empty
Still,
stomach,
okay.
and then drink plenty of water to prevent the esophagus
Yes, being
from getting irritated and
right.
getting ulcerated from this.
Now, is that the only reaction that is known, or can there be other side effects?
Yeah, there are a
on
lot
that?
more. There are a lot more, but this is one thing that we are worried about. And we have one other worrying side effect, which is called osteonecrosis of the jaw. That is, your jawbone, the mandible, the lower jawbone can get destructed, but that won't happen in every patient. Usual susceptible patients are ones who are receiving this drug for osteoporosis secondary to cancers. Now, there are certain cancer types in the bones, like myeloma. Multiple myeloma is a bone cancer. So bone cancers can also result in weak bones and then osteoporosis. In such conditions also we give the same medication. So such patients are more prone to develop this osteonecrosis or the destruction of the jawbone. The other patients are less likely to develop this osteonecrosis. But what we advise is, we advise patients to go to the dentist and check the jawbone and the dental hygiene, get it checked before the administration of these drugs. And annually, before administering the next doses, you have to check the health of your jawbone, and any teeth that need to be removed before starting these. So there are precautions that you can take to minimize such side effects from happening.
Doctor, what about the injection? Why does the patient need to be admitted to the ward for the injection?
Yes, usually this injection, there are not much of life-threatening complications, but since it is an injection, some people can develop allergic reactions. So they are advised to stay in the hospital, and it is given after putting it into saline. So it is given over nearly half an hour, and then you are observed whether you develop any allergic reactions. Sometimes allergic reactions can be life-threatening, so it needs to be managed in a hospital. That's why we ask the patient to get admitted to a hospital. And after giving this for 2 to 3 days, you may feel like flu-like symptoms may be there. Muscle pain, fever like myositis, muscle damage. So that can happen. So because of these reasons, it is given initially in the ward. But the same day, after a period of observation for allergic reactions, you can go home. And then you can stay at home safely for 1 more year. Next year, on the same day, you have to come and get the second dose.
It has to be the same day.
Not the same day, somewhere approximately the same time. So for 5 years, if you give this, your bone density will go up. This drug will go and inhibit that osteoclast. So there are a lot more newer drugs available, but practically what we use for osteoporosis is this bisphosphonates. Alendronate and zoledronate is the injection.
Thank you, Doctor. So interesting. And we have to end our discussion as time has caught up with us. So we thank you very sincerely, Dr. Nilangika Sandakumari, consultant physician and senior lecturer in pharmacology, University of Sri Jayawardhanapura, for being with us on the program and discussing osteoporosis. Thank you so much, Doctor.
Thank you for inviting me too.
Thank you also to Nishanta Manik-Divella for technical assistance. I'm Fatima Razi Kader saying good night and looking forward to your company next week, same time on Views on Health.